Can you give me an idea about the evolution of pharma supply chain that is happening in India, particularly in respect to the pandemic that happened?
What really happened was unprecedented. Pandemic of this nature that the world witnessed, probably Spanish flu, was about 100 years back. And then supply chains were not that interdependent. They were not this complex and global in nature. In supply chain parlance, if I have to say, it's like a black swan event, rarest of the rarest. And I like to, tell my colleagues and friends, like, we are not in the same boat. We were in the same storm. It was so unprecedented because both demand and supply came to a grinding halt at the same point of time. I mean, we know that pandemic started sometime around March 2020 in China when the lockdown started, And initially we thought that it is China-specific lockdowns, and we have seen disruptions from China coming in the past also. So pharma and supply chain were ready for that disruption. But what we were not ready is the entire world went to a sudden shutdown, lockdown, so to speak. I mean, first it was the West, US and Europe, and suddenly India also went into a lockdown mode in end of March, and we were not ready for it, honestly. We were not ready working with our vendors. We were not ready working with our factory managers, with our workers in the factory. We were not ready with our logistics service providers or our distributors. Nobody was ready for such kind of shutdown, and complete lockdown, localized lockdown and globalized lockdown, so to speak. State boundaries were locked down, countries were locked down, of course, flights came to a grinding halt overnight, and we know in pharma we are shipping a majority of our goods on passenger bellies. It was unprecedented and we were not ready for it. But did we react? Yes, we did react, but we reacted for the better. The evolution, so to speak, was happening. I would say I would not give all the credit to COVID, but it really got a very strong impetus with the COVID impacting us and all our lives so suddenly. So supply chain definitely got evolved and brought facets of supply chain, if I have to break it down downstream, into demand sensing, how we are able to forecast and demand sense and understand what the patient needs, which medications, how much quantity, where, etc. How we are going to do logistics and distribution of that. If I move upstream into my supply operations, how I can keep my factories running. And then the last piece of it, how I can make sure my material supplies keep coming. So because we are sourcing from a lot of vendors, across the globe, in India and specifically in China also. So all that needed to be revolutionized, and there was a very big evolution around all these aspects, in my opinion. Yeah.
There are many changes happening in on all these processes. Also, pharma shippers has to deal with many stakeholders. You mentioned some of them right now. So how really COVID changed that relationship, or how they responded to these, kind of disruption? And what is the change that you could see after COVID, in the relationship between a shipper and these stakeholders?
Earlier, we would have vendor-customer relationship, more of it. They are my logistics service providers. They are my kind of vendors. I request for quotations from them for my shipments to move. They give me the best quote. I negotiate, and then we go ahead with the shipment. This was BC, before Corona. In the AD phase, so to speak, in the after disease phase, now we have become partners. We've started collaborating much more. We spoke about earlier in the day about, how we have started collaborating with our logistics service providers, how we have started getting into short-term and medium-term contracts with them, because we understand the volatility that is happening with both in terms of availability of space, both in aircrafts and on ships, etc. And also the cost factor, which is shooting through the roofs, So we need to protect our interests, and we also need to make sure our logistics service providers and freight forwarders are in the best position to support us and help us. So we have started looking at them as, our collaborators, our business partners.
What are the kind of technology interventions that are coming into this kind of new processes? Like we're talking about a demand sensing, for example. Yeah. So what are the kind of technologies coming in?
Technology front, I think we are just touching the tip of the iceberg. It's at the cusp where it's going to explode into an entirely new horizon as to how the entire supply chain function is going to operate, in my opinion. Demand sensing is just the tip of the iceberg. Again, the way we forecast, how we are able to look at sales data, how we are able to look at macro and micro factors in doing my forecasting. So time series and statistical models are, in my opinion, not capable to look at proper demand sensing in the VUCA world that we are living in today. The volatile, uncertain, complex, ambiguous world. As simple as a boat getting stuck in Suez Canal can disrupt your supply chain. We've seen that. I mean, as we speak, we know there is war in one part of the world. Any geopolitical situation can again disrupt our supply chains. Forget about pandemic. There are multiple disruptions that, we as supply chain professionals are looking at in today's world, and today's complex, globalized supply chain world. So it is very important that we use technology, because technology is going to assist us to bridge that gap of understanding of what we can see on ground and how we are able to forecast and look at the various factors which are going to disrupt my supply chain. It starts with demand sensing, of course, downstream, if we have to look at, how we are forecasting, etc. And the entire integrated business planning model, how I am able to do my demand sensing, how that is translated into what needs to be shipped, when, where, my logistics and distribution network. Over there also with Industry 4.0 and blockchain, how I am going to do my, data exchange electronically, so it is both fast and accurate. If I move a little upstream to my operations, again, with the advent of technology, I'm looking at predictive analysis. I'm looking at when and where I need to look at my equipment shutdown, if it is going to have a breakdown, etc. So my operating efficiency improves. And if I move further upstream to my vendors, what kind of visibilities I can provide to my vendor and to my vendor's vendor. And at the same point of time, I get that visibility. All this is only possible, in my opinion, with the embracement of technology. Industry 4.0, in my opinion, is going to, stitch this entire value chain end to end, in my opinion. And we are very soon going to talk about Industry 5.0.
You listed so many technology interventions into this pharma supply chain, but all these technology interventions would need huge investments from the shipper side of it. What is the nature of investment that you could see? For example, are they all creating in-house, or are they partnering with new technology companies? To give an idea about it.
In my personal opinion, it's not very capital intensive. When we start talking about I need to digitize or I need to do transformations, what kind of investments does it call for? Is it going to cost me a lot of time, money, effort? So at least I know on the financial part of it, not everything is expensive, and we don't need to embrace everything together. We can take baby steps. We can look at one part of the value chain. We can look at that first, embrace the technology, see how we are able to improve our supply chain efficiencies and processes using digital tools and transformations on that one particular node, and then move into other pockets. And in my opinion, it's not very capital intensive. In terms of efforts, yes, a little bit of effort from the existing team, openness of mind is needed to embrace new processes and technology. As individuals, as supply chain professionals, the biggest thing we need to do is transform and do a lot of learning and unlearning for ourselves and relearning for a lot of things. In my opinion, that is how we are going to make ourselves ready for the supply chain of tomorrow. Because let's be honest, it is here to stay. This is the only way forward. In my opinion, investing in the right talent and bring them on board and train them so that they are able to maximize this technology. That in my mind is very important, and as business leaders we need to be very conscious that we need to invest in our people, because people are who are going to use these digital tools to maximize business output.
Just in time was an efficient, at least before COVID, supply chain method. So it was disrupted by COVID. Many say that we moved to just in case, for example. So where pharma supply chain is moving right now, can we have the just in time coming back?
Just in time is not dead. It is still there. In pharma, so to speak, we were never really doing just in time, because in pharma we have a lot of regulations to take care of. Any item, any raw material or any product, any API or any excipient that comes into our factories, we need to make sure we test it, release it, etc. So our cycle times are generally longer. So we always believed in having the right inventory. So in my opinion, in pharma, just in time was never really a predominant supply chain strategy, but just in case is definitely something that we have started proactively looking at, because now with all the disruptions and different scenarios that are building around us, say for example, today I'm sourcing a material from a particular country and that vendor has a supply chain disruption because of material, because of geopolitical situation, because of calamities, etc. We don't know. So in that case, what is my plan B? So we have now proactively started looking at scenario planning, and that is where a lot of risk mitigation strategies are also coming into play. What was previously a good to have risk mitigation strategy, that as a supply chain professional I need to have for my top molecules a risk mitigation strategy and develop a vendor A and a vendor B and a manufacturing site A and a manufacturing site B, so that if any of the sites or vendors has a disruption, I have a backup option. So those now risk mitigation initiatives have now taken a new shape and form, in my opinion, and have taken a perspective of business continuity, of how we are able to ensure that even if there are disruptions disruptions of huge natures in my supply chain. My key products, my key value drivers of my business, I am able to deliver, and I have business continuity. And that is where a lot of scenario planning, a lot of just in case is coming into play in supply chains across domains, and pharma is no exception. And I have to agree that we have now started looking at it.
There is an increasing need for the movement of temperature controlled pharmaceuticals from the shipper side. There is a demand for it. So can you give me an understanding about what is the level of that demand coming in, first of all? Second, how you are dividing it between the air and sea mode, for example?
When you talk about pharma shipments, you're always talking about cool chain and cold chain. So there are two aspects to it. So I mean, generally, if it is ambient temperature, it does not matter. I mean, if it is air or sea, I mean, you put it in your freighters, sea containers, and you ship it. If you have the time, to ship it. I mean, it's all a function of, what is the demand and how much is the urgency to, for that medicine or that, medication to the patient end. What is the stock levels at the country or at the location where we need to ship it. So, but in cold chain, when we look at it, 2 to 8, if you have to talk about particularly, where a lot of air shipments also come into play, because cold chain, are generally on probably more complex formulations, not your normal oral solids. It's more on biologics, biosimilars, and vaccines. We know India is the number one manufacturing hub for vaccines globally, so that, and with all the corona, COVID pandemic around us, and with all the vaccination globally that has to happen, definitely there has been a bump in with respect to, more shipments. We're looking at more shipments, as an industry looking at, sending more 2 to 8 out. But overall, if I have to see, I mean, with proper planning, end-to-end planning, and the visibility and all the digitization that I talked to you about, ideally I need to be planning in a way that I do not send maximum or majority of my goods with air, rather I send it by sea. I mean, I would rather say ideally it should be a 20-80 ratio, where 20% is only going by air, all your critical, probably extremely high value and short in market products going by air, and typically everything else goes by sea, because in sea, again, with reefer containers, I have controls with respect to, I set the control temperature on my reefer, and then, with proper alignment and collaboration with my freight forwarders and logistics service providers and the shipping lines, I make sure that there are no temperature excursions, and I'm able to, ship my goods in a timely fashion and in a very cost effective fashion. Because like I said, I mean, India is the pharmacy to the world today. And we are here to cater to the 7 billion plus people of the world. We are not just looking at the first world countries where, they can absorb those, cost of air shipping. I'm looking at shipping critical drugs to, emerging markets, to Africa, etc., where I need to make sure that they are shipped in the most cost effective, affordable way, not compromising the effectiveness or efficacy of the drugs. So then a sea shipment really makes sense for me, if I can plan it well.
As a shipper, you might have seen the evolution of the logistics players who move your pharmaceutical goods from point A to point B. So can you give me an idea about, are they really listening to you and provide some innovative solutions?
I have to give a lot of credit to the shippers who came up front, worked with us. Even they were under a lot of pressure over the last 2 years, because with all the COVID happening and how they can ensure their bio bubbles, they were also under risk of infections, if they could have carried it back there to their homes, I mean, they have families. So I would say tremendous. I mean, and I'm very happy that we were able to work with them, and a lot of innovations, we started talking about rail shipments, that in my mind is one of the takeaways for us in COVID. I mean, earlier we used to think only air, sea or road, we started talking about rail shipments, and it is really convenient, easy and cost effective, I mean, just to give you an example, I mean, if I have to move something like from manufacturing facility in Goa to Sikkim, it will take about 12 to 15 days by road, with the driver stopping and, across the borders, crossing, etc., and vehicle breakdown and all. But with rail shipment, it can go there in 3 to 4 days, I can just put it on the rack and then it goes, I mean, and it becomes so convenient. So all these kinds of innovation, I mean, this is just one example, but we came and we sat across the table and we saw how we can, utilize, whatever is available at our disposal to make sure that the right stuff reaches the right people, at the right time.
What do you think about the future of pharma supply chain? How it would would look like maybe next 5 or 10 years, for example, from your point of view? Also give us some takeaways and learnings.
Different functions or nodes of supply chain, be it planning, be it inventory management, be it logistics and distribution, or be it procurement. All these key aspects or drivers of supply chain are going to get transformed, and for the better, going to make us more agile, faster and more flexible, in my mind. Ensure we are able to utilize our capacities better so that our cost and operational efficiency improves, so that we are able to make cheaper drugs, of course, with more technology adoption, so that more and more people are able to afford, across the globe, life-saving drugs. So that, in my mind, is the bedstone of how supply chain and pharma in the near, mid to long-term future. And if I have to share 3 or 4 takeaways with all the listeners, so I would say number 1 is we need to be looking at how we are going to make our businesses sustainable. So before we become bigger, we need to become better, so that there is business continuity, business sustainability, how our supply chains are sustainable. That, in my mind, is very critical. How we are going to be doing scenario planning, look at different options of how we are going to have business continuity, how we are going to invest in the right talent and develop them to be future ready, to enable and drive supply chains of tomorrow. Digitization, like I told you, is the cornerstone, bedstone of the entire supply chain ambit going forward, because that is how it's going to be, in one big, so to speak, circle, which is getting connected with the digital thread. So yeah, that's my 3-4 takeaways. And what I would like to tell all viewers over here, that, it's time for supply chain professionals to reset the expectations. You were talking about JIT, right? Just in time. We are talking about, 5 days delivery, etc. We are talking about operational efficiency. We are talking about undisrupted supply chains pre-COVID. It's time for us to reset the expectations. It's time for us to tell businesses, tell everyone that disruption is here to stay with us. This is the new VUCA world that we are going to stay in. So reset expectations. Your expectations of inventory, your expectations of lead times, your expectations of delivery, your expectations of how quickly we are able to meet market, volatilities or demand fluctuation. It's time for us to reset those expectations, in my opinion. It is very important that we take the limelight at this point of time, because supply chain predominantly, historically, has only been functions which looks at procurement probably, or it looks at distribution and logistics. Now people have understood what supply chain actually does end to end, and it is time for us to become an enabling function more than just a coordinating or a function that works with other facets of the business. That's my takeaway.
Thank you so much, Vickram.
Thank you so much
for joining us.
Pleasure.